this afternoon. Imagine that you're the parent of a 9-year-old girl, and your daughter has horrible seizures, intractable seizures, and you've had a relationship with a physician since that child was a baby. You've worked hard together with the physician to be able to develop the right to find the right combination of anti-seizure meds to keep the seizures under control. And things have been great for about 3 or 4 years. Then all of a sudden your insurance changes for reasons well beyond your control. And the next time you go to get your medications filled, to get your daughter's medications filled, you're told that it can't be done. The insurance company has denied them. Imagine that. So you call your pediatrician in a panic, and that pediatrician spends 2.5 hours on the phone working with the new insurance company, going up the ladder from the first person at the phone tree up to the medical director to convince them that in fact these are the right meds and we don't have an alternative. Imagine what would happen in that scenario. Make it even worse. Let's say your insurance company says you can't see the pediatrician anymore and they deny your meds. What do you do? Where do you go? That's a circumstance that we find ourselves in all the time on both sides of a healthcare relationship, from the physician, from the healthcare provider side, and from the family side. I'm really pleased to be able to be here today to share some of the information from the Family USA study, Health Reform for New Mexicans with Pre-Existing Conditions. The results of the study are fairly alarming, not surprising, but alarming. And what they reveal is that there are approximately 380,000 New Mexicans under the age of 65 with pre-existing conditions, which means that almost 1 in 5 New Mexicans could be unfairly denied insurance without healthcare reform. Thanks to the new healthcare law, as soon as this year, almost 40,000, about 36,400 New Mexico children who have pre-existing conditions, kids that I see every day, will no longer be able to be denied that coverage and will be able to continue our relationship. We know that healthcare reform is necessary because pre-existing conditions, as I illustrated, often, not only do they exist, but the longer a child lives with a pre-existing condition, the higher the risk, the greater the risk becomes of them being denied, because their insurance coverage is almost certainly going to change over the course of their lives. It's critical that we be able to treat these individuals effectively and with the highest possible quality. In New Mexico, if insurance companies are not indeed held accountable for this unfair practice of denying coverage for pre-existing conditions, it would mean that almost 1 in 6 young adults from the age of 18 to 24 could be denied coverage. It means that more than 1/3 of New Mexico adults aged 45 to 54 could be denied coverage, and nearly half of those adults from age 55 to 64 could be denied. As a result of this necessary health care reform, no American with a pre-existing condition will be denied coverage, charged higher premiums, or sold a policy that excludes coverage of necessary required health benefits simply because they've been living with a pre-existing condition. As a physician, as somebody who does this every day, my colleague, Dr. Aceves, it gives me a phenomenal amount of comfort to know that I will be empowered to be able to give the best possible care to the families with whom I work.
The good news is that about 64,000 kids and young adults under the age of 24 are now going to be able to get medical care. This is the number that Families USA has determined from those that have reported these often chronic, serious conditions. These are the about 1/6, I think, of all the population that could be denied coverage and often are denied coverage. So this is a really important day, and September 23rd, which is the day that these folks will be able to get coverage, is going to be a great day for New Mexico and a great day around the country. And it's going to be a great day not just in terms of the fairness of these families not being able to perhaps change jobs because they're afraid they'll lose their insurance, and then the next job will be, their insurance will be able to turn them down because of a pre-existing condition, not cover something like diabetes, not cover something like allergies. And the list of pre-existing conditions is not just those serious diseases, that we think of, but it is also some small things, migraine, headaches, obesity, which is a big problem here in New Mexico and elsewhere. But these folks often are going without coverage now. And when they go without coverage, what happens is the whole population is unhealthier. And then what happens then is that folks don't go in for regular checkups, and they present at a later time, and that pushes up the cost of health care for everyone. So this measure embedded in the bill is not just a matter of fairness, and it's not just necessary because all these people would not have coverage, but it also is ultimately going to lead to cost containment, because that's what we need, for everybody to be covered, and thus going in for those regular checkups.